Assalamu alaikum to dear viewers of Knowledge Galaxy. Today our topic is what happened in brain hemorrhage. Brain bleeds. Bleeding between the brain tissues and skull or within the brain tissues itself can cause brain damage and be life-threatening. Some symptoms include headache, nausea and vomiting, or sudden tingled weakness, numbness, or paralysis of face, arm, or leg. The most people, a brain bleed simply means any bleed inside your head. However, a doctor, and specifically doctor who treated brain bleeds, neurologist or neurosurgeon, would say that a brain bleed, also known by the medical term intracranial hemorrhage. To better understand brain bleed, it is important to have a basic understanding of the different types, for there are two main areas where brain bleeding can occur. Bleeding can occur either within the skull or outside of the brain tissues or inside the brain tissues. Bleeding within the skull but outside of the brain tissues. The brain has three membrane layers called meninges that lay between the bony skull and the actual brain tissues. The purpose of the meninges is to cover and protect the brain. Bleeding can occur anywhere between these three membranes. The three membranes are called the dura mater, arachnoid, and pia mater. Epidural bleeds. This bleed happen between the skull bone and the outermost membrane layer, the dura mater. Subdural bleed. This bleed happens between the dura mater and the arachnoid membrane. Subarachnoid bleed. This bleed happens between the arachnoid membrane and the pia mater. Or brain bleed fatal. Brain bleed, regardless of location, usually happens suddenly. However, some, for example, subdural, can take days to weeks before symptoms develops. A brain bleed causes brain damage, and yes, they can be life-threatening. To serious in the outcomes of a brain bleed depend on its cause, location inside the skull, size of the bleed, and the amount of time that passes between the bleed and treatment, your age, and overall health. Once brain cells die, they cannot regenerate. Damage can be severe and result in physical, mental, and task-based disabilities. What are the causes of brain bleeds? Head trauma caused by a fall, car accident, sport accident, or other types of blow to the head. High blood pressure, which can damage the blood vessels walls and cause the blood vessels to leak or burst. Build-up of fatty deposit in the arteries of the brain. Blood clots that formed in the brain or travel to the brain from another part of the body. Ruptured cerebrum. Build-up of amyloid protein within the artery walls of the brain. A leak from abnormally formed connection between arteries and veins. Bleeding disorders or treatment within the therapy. Brain tumors. Smoking. Conditionality to pregnancy or childbirth. A conditionality to abnormal collagen formation in the blood vessel walls that can cause walls to be weakened, resulting in a rupture of a vessel wall. Thank you so very much for watching. Kindly like and subscribe our channel and push the bell icon button for more updates.